thank you so much for tuning in to Carly B TV. I'm Dr. Carlicia Booz. May is Mental Health Awareness Month, and this is a time where many people are raising awareness for those who are living with mental illnesses or behavior health illnesses. And we have Bruce Kahn, who's a licensed marriage and family therapist with Piedmont Macon, and he's going to talk more about, some of the factors that people that lead to mental illness, which is suicide. We're going to start with suicide. So thank you so much for joining us, Bruce.
Happy to be here with you, Carly B.
Absolutely. Absolutely. So suicide, what are some untreated mental problems that could lead to suicide?
Well, the first place you would start is just a big category of major depression. Suicide, suicidal thinking, suicidal ideation are a symptom of major depression. Anxiety can get you to suicidal thinking. Bipolar also, but also people who struggle with addictions, alcoholism and other addictions can become very hopeless and find themselves with some suicidal thinking.
Okay. So what are some signs to look for, if a family or friend, are just noticing, different, I would say, behaviors in someone? What are some signs to look for if someone is struggling with suicidal thoughts?
It's good to trust your own gut feeling that you notice somebody is struggling, and some outward signs might be just how they look, that they look more flat, that you notice they're more withdrawn. One of the hallmarks is people sort of wrapping things up, sort of finishing up by giving things away, or having a little bit more demonstrative goodbye, or I needed to always finish this, whatever this business was, paying somebody off, or some statement that they needed to clear up. So just sort of those last things that people will do sometimes. So you can definitely notice those outward things, but also just trusting your gut. That's the thing I even tell my children: trust your gut when you've got a sense that somebody is struggling, and then you got to name it.
Right. And I know oftentimes, people will try to, if they're dealing with it, and I know you mentioned depression, if maybe the loss of a loved one and they're constantly being alone, what are some things that, family and friends just could do to, get them out of that routine of trying to be alone? Obviously it possibly can lead to, suicide.
That's right. Almost any mental illness is going to lead to a sense of shame and isolation. And so anything you can do to reach out and include or invite people, to affirm people, to involve them somehow. And it's always nice to be asked. I like it when somebody asks me to do something with them. So it's always nice to be asked. So it's okay to reach out, and maybe you don't name it specifically, but initially just to say, let's do something together. I miss you. So just staying connected is the key ingredient there. Isolation, the problem; staying connected being the solution.
Now, is this often seen in adults, kids, or does it vary? When it comes to
Well,
suicide?
it really doesn't discriminate. It can be in any population group, certainly with adolescents. We always have to be careful. You don't see that mentioned in the news because it can be actually contagious with adolescents. The biggest population group to go forward with this would be older folks, but it can affect anybody.
Okay. Now, last thing, let's talk about treatment options. Now, obviously, you said, getting them out of that isolation state, but are there any treatment options that, maybe Piedmont Macon offers, or, just some referrals that, people watching may be able to, get some of their friends or family members help?
Yeah, a couple of options here at Piedmont, but you might start with your internal medicine doctor, your primary care, talking with them. But coming to Piedmont, if it's a particular crisis, I mean, things are really, really desperate. So you can come to our emergency room, get evaluated, and get referred to care. And maybe that's inpatient, and sometimes that's certainly needed, and it may be outpatient. So you can come here or just call here for an evaluation for an outpatient treatment program, just a place to talk and learn some new coping skills and overcome this really devastating problem. Nobody needs to commit suicide. It's such an irrational place, not a place we want to suggest for anybody else. So an individual thinking that is a big problem, and there's certainly help when somebody gets to that very hopeless position.
Okay. Well, thank you so much, Bruce, for coming on and just sharing this helpful information. Are you a homeowner, a parent, or own a business? What happens to those assets in the case of death?
Hi, I'm Cassandra Barron, your local life insurance agent. Life insurance protects your income in the case of death. Call me for your free quotes today.
Affordable coverage for the whole family, immediate coverage, no waiting period, multiple kids coverage for one price. Call Cassandra Barron today.